Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Alif Imran bin Azli. My metric number is 1200121. In this video, I will explain the definition of bipolar disorder. Bipolar disorder is formally known as manic depression, mental health illness that involve emotional high, mania and hypomania, and lows, that is depression. You may feel ecstatic, full energy, and abnormally irritable when you mood switch to mania or hypomania, a milder form of mania. These mood swings might impact sleep, energy, activity, judgment, behavior, and the capacity to think effectively. Next, there are three types of bipolar disorder: bipolar disorder 1, bipolar disorder 2, and cyclotimic disorder. Bipolar disorder 1 is when a person has a manic episode, they are diagnosed with bipolar 1 disorder. Bipolar 1 disorder, patients have an extraordinary surge in energy and may feel on top of the world or uncomfortably angry during a manic episode. Some people with bipolar disorder 1 also experience depressive or hypomanic episodes, and most people with bipolar disorder 1 also have periods of neutral mood. The next type of bipolar disorder is bipolar 2 disorder. At least one major depressive episode and at least one hypomanic episode are required for a diagnosis of the bipolar 2 disorder. Between episodes, people resume their normal routine. People with bipolar 2 disorder frequently have other mental illnesses such as an anxiety disorder or substance use disorder. The third and last type of bipolar disorder is cyclotimic disorder. Cyclotimic disorder is a milder variant of bipolar disorder characterized by mood swings and hypomania and depressed symptoms. Cyclothymia is characterized by emotional ups and downs but with fewer and milder symptoms than bipolar 1 and bipolar 2 disease.
Assalamualaikum warahmatullahi wabarakatuh. My name is Aisyah Shazlin binti Shahimi and my metric number is 1200122. I am going to present the symptoms of bipolar disorder. There are several types of bipolar and related disorders. They may include mania or hypomania and depression. Symptoms can cause unpredictable changes in mood and behavior, resulting in significant distress and difficulty in life. Symptoms can vary from person to person, and symptoms may vary over time. Mania and hypomania. Mania and hypomania are two distinct types of episodes, but they have the same symptoms. Mania is more severe than hypomania and causes more noticeable problems at work, school, and social activities, as well as relationship difficulties. Mania may also trigger a break from reality or psychosis and require hospitalization. Both a manic and a hypomanic episode include three or more of these symptoms. The first one is abnormally upbeat, jumpy or wired, increased activity, energy or agitation, exaggerated sense of well-being and self-confidence or known as euphoria, decreased need for sleep, unusual talkativeness, racing thoughts, distractibility, poor decision-making. For example, going on buying sprees, taking sexual risk, or making foolish investments. The next one is the symptoms for major depressive episode. A major depressive episode includes symptoms that are severe enough to cause noticeable difficulty in day-to-day activities such as work, school, social activities, or relationships. An episode includes 5 or more of these symptoms. The first one is depressed mood, such as feeling sad, empty, hopeless, or tearful. In children and teens, depressed mood can appear as irritability. The second one is marked loss of interest or feeling no pleasure in all or almost all activities. The third one is significant weight loss when not dieting, weight gain or decrease or increase in appetite. In children, failure to gain weight as expected can be a sign of depression. Either insomnia or sleeping too much, either restlessness or slowed behavior, and fatigue or loss of energy. Continuing from the previous slide is the 8 symptoms for major depressive episode, which are feeling of worthlessness or excessive or inappropriate guilt, decreased ability to think or concentrate or indecisiveness, and the last one is thinking about planning or attempting suicide. That's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Khalil Hazib bin Khalid. My metric number is 1200107. So I will continue the presentation by presenting about bipolar disorder treatments. There are three treatment options that can be considered, which are pharmacotherapy, biopsychosocial model, and cognitive behavioral therapy or CBT. Firstly, we will go to the first treatment, which is pharmacotherapy, or we can call it as medication. So there are two types of medication that we will focus, which is lithium and antidepressant. Firstly, lithium. Lithium is one of the most commonly used and researched drugs for bipolar disorder treatment. Mania is less severe and occurs less frequently when lithium is used. It may also aid in the treatment or prevention of bipolar depression. According to research, lithium can greatly lower the risk of suicide. As a result, it may be recommended as maintenance treatment for extended period of time, which even between episodes. Lithium has an effect on the central nervous system, which cover the brain and spinal cord. If the medication is stopped within 2 weeks, it may produce a many episode. Hence, a gradual withdrawal from the medication is advised. Secondly, antidepressant. Antidepressant can occasionally produce many episodes. They are frequently administered in conjunction with a mood stabilizer or antipsychotic. It also reduces the chance of recurrence of depressed mood, but increase the risk of producing mania. If the patient is taking it overdose, it might trigger them into many episodes. Okay, let's go to the second treatment, which is biopsychosocial model. Biopsychosocial model, initially proposed by George Engel in 1977. Biopsychosocial is a way of treating disease and fostering improved health that involves the interaction of biological, psychological, and social aspects. Biopsychosocial can develop awareness about the disease or disorder faced by person. So, this is the biopsychosocial model. As we can see, this theory contains three factors that influence a person's mental health. A psychologist will examine all factors that contribute to the patient's mental health, whether biological, psychological, or social aspect. The psychologist will be able to establish what causes the patient to be depressed or manic in the situation of bipolar disorder. As a result, the psychologist may simply discover a strategy to lessen the trigger, whether through medication or treatment. Lastly is cognitive behavioral therapy, or CBT. CBT is a treatment involving self-monitoring, problem-solving, desire to take medication consistently, and active relapse prevention techniques. It also aims to educate patients how to monitor, analyze, and alter dysfunctional thinking and behavior connected with negative mood states. It also trains the patient to recognize, confront, and replace harmful thoughts related with negative mood states with more beneficial ones. CBT is specifically intended to prevent relapse and enhance adherence in patients who have frequent relapse. As a second-line supplemental therapy for acute bipolar depression, and as a maintenance treatment for people with fewer episodes and a less severe type of bipolar disorder, lithium is recommended, which can maintain or stabilize their mood.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nuruzulaika Liana and my metric number is 1200151. I'm going to be presenting the treatment of bipolar disorder according to Islamic perspective. Imam Al-Ghazali's psycho-spiritual model approach that focuses on the perfect human being based on four aspects, which is qalbu, ruh, akli, and nafs. Firstly, we go to what is psycho-spiritual. Psycho-spiritual is a term used for the integration of the psychological and the spiritual, usually heard in psychology and religion. A supplementation of the two fields, A psycho-spiritual approach refers to the mind, the psycho and the spirit, so it includes both the personal and the metaphysical. The psycho-spiritual includes themes like the mental, emotional and physical trauma and spiritual healing, a situation of soul loss, uniting the mind and heart, discovering one's spiritual calling, searching for the meaning of life, shadow work, getting in touch with one's true nature. In psycho-spiritual healing and counseling, there's a recognition that perhaps depression, anxiety, and other mental disorders include the chemical imbalance and psychological elements as well as the spiritual experiences of the person suffering from the disorders. The idea is to look at a person, a patient in holistic way, minding the body, the mind, and spiritual manifestation of the disorder or disease. As part of the psycho-spiritual approach, psychological changes, mental health symptoms and emotional crises are seen as a possible catalyst for growth and transformation, leading to positive life changes and expanded state of consciousness. For the last, as Allah subhanahu wa ta'ala said in Surah Az-Zumar verse 9, say, are those who know equal to those who do not know? Only they will remember who are people of understanding. Thank you from me.